Could you give somebody who maybe isn't familiar just maybe a snapshot of the types of funds, the types of initiatives, the types of programs that you're helping to fund, just kind of areas of the community so they could get a little snapshot of kind of the needs that you're filling as far as...
Yeah, and it's interesting because it's very broad.
That's what I was saying.
Right?
Yeah.
So it's very, very broad. I would say...
It's not just one area.
I would say the largest focus area is around health and well-being in our community.
Okay.
So we have the two health foundations and the William Swanston Charitable Fund that's also very interested in the health and well-being of children, right? And we worked together to create the Healthy Community Partnership about 5 years ago, and that has taken off and has a life of its own, but is very closely intertwined to the work that we do. So a lot of our funding is around that health and wellness kind of endeavor, right? So we do support the work of the Healthy Community Partnership. We fund things that have to do with parks and green spaces, active transportation, access to healthy food. For example, we've funded positions for a healthy food access coordinator, both in Mahoning County and Trumbull County, to work with local community stores to help build up healthy options in those stores.
Okay.
And so they work to try and solve the problems like, you can't get fresh produce delivered in very small amounts to out-of-the-way places. So how do we coordinate this in a way that can help? How do we educate the community to know that these resources are available to them now in their own local community stores? So we're doing a lot of funding around those things. And then we have scholarship funds, so there's a lot of money that goes out in scholarships every year, and we work with a number of different organizations across both counties funding scholarships. We're in the midst of that right now, the scholarship award selection process. And we also fund health and community services, social services, things dealing with recovery, so across the board.
Yeah.
Depending on a lot on the individual donor interests too. When they create a fund, there's a lot of matchmaking that goes on from the request from the community to areas of interest of each donor.
And one, I didn't know if you wanted to talk a little bit about it. It applies, you were talking about getting healthy food into certain areas. I believe one of the highlights of your report was the Action Mobile Market.
Right.
Did you want to talk a little bit about that?
Sure. Yeah. That's a program that Action put together, and that was done in partnership.
I got to see it. I got to go inside of it.
You got to go inside. It's pretty cool,
it was really
isn't
neat.
it?
It was out at the library on the east side.
Yeah.
And I went out there and got to walk through it and everything. And there was a lot of stuff in it, actually.
It's pretty cool.
Yeah, it was neat.
It's pretty cool. So the idea behind that was generated out of a lot of work that had been done with pop-up farmers markets and making produce and fresh foods available in a variety of ways in neighborhoods and locations that don't often have them or don't have a large grocery store and don't have that selection. So over the years, Action has been very involved in the Healthy Community Partnership and the Healthy Food team. This idea developed to create the mobile market. So
tell them what it is.
Well, it is a big
it's a mobile market.
It's a mobile market.
Yeah.
It's a big refrigerated little bus.
It's like one of those Anderson buses.
Yeah, it's not quite that big.
It's pretty big though.
Yeah, it is.
And then it has on both sides. It's got like a section for produce. There's freezers. There are refrigerators. There was it was way more involved than I thought. I thought it was just going to be kind of a gutted bus.
Yeah,
that was going to have stuff in it.
No,
it was
a
like
lot
a grocery
more than that.
store.
It's like a little grocery store on wheels. Yes, it is. And so they visit different locations and provide access to healthy food. So yeah, that's one of the things that we funded.
So is there anything else you want to make sure we touch on?
Well, I think the other thing is our staff is growing.
Yes.
So we have added 3 full-time positions. One of them is somebody we brought on at the end of 2022 as a temporary position, and now or 2021, and then turned full-time after the first of the year. And then we also hired a action team coordinator to work with the Healthy Community Partnership. We have the finance director, who's the person that came on full-time, and then the grants and operations administrator position is also new. So that brings our total staff up to 8.
Okay.
Which is 10 years ago when I started, we were at 3.
Right.
So that's,
Yeah.
we're growing. We're doing a lot of
Which
things.
is good.
And that's exciting.
Yeah.
It is. It's
Well,
very
growing
exciting.
because you need capacity because you have so many services is a good thing. Yeah. Anything else?
Well, I think one thing that is really important to us that is worth highlighting is a focus on equity and inclusion in terms of our work. So we have spent a lot of time thinking a lot about how to be sure that we are listening to all voices, including all voices in decision making, about how we can change our process and procedures that makes us more accessible in terms of just being there as a resource and information, but also through our grant
Right.
making and all of that, and how we make sure that we distribute our resources equitably and fairly across the valley into the groups. And so that has been the cornerstone of the strategic plan and the work, a lot of the changes that you've seen in terms of our outreach coordinator position and all of those things is how do we get to know the people that don't know us? The smaller groups, the groups that have not always been in the mainstream, if you will, for resources and do a better job of connecting with that. And that really has been the focus of just about everything we've done. And I think that's a really important thing to highlight.
And you can find all of this, if somebody has questions, they can find the annual report, they can find a lot more information at your website,
Yes.
cfmv.org.
Correct.
Correct, okay. Did you want to, I knew you had 7 new funds also. I had that written down. Did you want to talk about that or not?
Well, we did 7 new charitable funds are part of our
7
portfolio
new,
now.
I mean, partners, basically.
Right.
Yeah.
And
So that's good.
Yes, it's very good. Can always be better. The
Sure.
more partners, the more work we can get done, right?
Exactly, yeah.
So, yeah.
I can't open a fund, I'm sorry. I don't have enough money. I'll help out in any other way I can.
Well, you can. You can contribute to any existing fund. Did you know that?
Oh, no, I didn't.
You don't
No.
have to have. That's one of the, that is interesting. You don't have to, first of all, if you're starting a donor advised fund,
Yeah,
$10,000. So it's not millions.
right.
And you can take 5 years to build up to that point before you make distributions. So you can do it over a period of time.
Oh, okay, cool.
But we also have funds like the Fund for Women and Girls.
Right.
That's a field of interest fund, is what we call it. And you can make contributions of any size to that fund
Right.
and support women and girls in our community.
Okay.
And so you can be a part of the decision making in a microfunding event about who's going to receive the grant from that fund during the course of the year. So you can be involved in many ways.
717 Credit Union. Business services designed to meet your daily needs. Commercial loans, business deposits, merchant and payroll services. 717 Credit Union. It's knowing you were treated right every time.